Hi there, my name's Tom Contio. I'm a pharmacist with the Thames Valley Family Health Team. Welcome to the Leave the Pack Behind recording. This session was originally developed as a online module for individuals, but we felt it important to record a version of it so that you can have the benefits of this type of information at your own leisure. So this particular presentation was going to have a couple of things we're going to talk about today. We're going to be talking about why quitting, benefits of quitting. We're going to talk about addiction, maybe some quitting strategies, and then I'm going to also review the many medications out there that may actually help. But we're going to also spend some time working on that psychology or the behavior of quitting smoking. So let's get going. We'll start off with a small video. It's about 8 or 9 minutes with Dr. Mike Evans, and it really covers some of the salient points. So I'll leave you with the video and then we'll come back and discuss more on the other facets. So enjoy.
Hi, I'm Dr. Mike Evans, and I think quitting smoking is a journey. For some, it's a short journey full of resilience, but I think for most, it's a long journey, a long affair, if you will, of quitting and relapse. A complicated relationship that can have as much to do with a person's relationship with themselves as with the cigarettes. What starts as a pleasant sensation, an opportunity to rebel, or even to belong, is replaced by less pleasure and a feeling of being trapped. A daily or hourly ride of nicotine withdrawal, and then another cigarette which brings relief. Most teens who smoke think they will quit in their 20s and actually don't till their 40s. Stopping smoking is about making a change, and that is something we're not too good at. When I think of change, I think of two concepts: where you are at and the mechanics of how we change. So we should start where you are at. When I started medical school, I thought I could take somebody who smoked and convert them into a non smoker in one fell swoop. Now I see it differently. I focus on where the person is at. You may be in what we call pre contemplation, where you're not really even thinking about change. Approximately 75% of smokers want to quit, but 25% are not interested. Maybe you're at the contemplation stage, thinking about it, but not quite ready to act. Next is preparation. This is critical with smoking, especially in the likely event that you've tried to quit before. What has worked in the past and what hasn't? What caused the relapse? Maybe you're at the action stage. This is when you're ready to make your move. There's never a perfect time to quit, and at one point you just have to jump. I'll tell my patients, hey, it's going to be a challenge now, and it's going to be a challenge in 5 years, so why not do it now? And finally, there's the maintenance stage, where you become a non smoker and are trying to stay that way. When we make changes, critical to stop and think, how important is this change to me, and how confident am I in making this change? What we call your self efficacy. Your job is to be honest. My job is to see if I can move your scores towards 10. The second concept is about the different parts of change. So there's the what. What are we changing? With smoking, I suppose it is straightforward, stopping. But if you think about it, you might be changing lots of things. I think it is like a relationship breakup. You start by just keeping things simple and low risk. You might break up your routine a little bit, avoid certain places, maybe use that juicer every morning to distract yourself. But you will need to change more than your smoking to stop your smoking. The next is the why. Why change? I feel like I could do a 10-minute video just on all the medical reasons why not to smoke, and they are legion, but I'm going to spare you. Partly because you already know, partly because you don't need any more guilt, and partly because in clinic I actually spend more time asking people what they like about smoking. Which sounds funny, but I think we have to recognize there are positives, or at least perceived positives, and I think it's important to reframe these perceptions if we are to make a change. So let's run through a few of the common ones. Cigarettes are my friend. They de-stress me. They relax me. I'm not going to deny that you may feel a sense of relief and satisfaction when you have a cigarette, but I see it a bit differently. You have a nicotine addiction. The nicotine in tobacco is highly addictive. Within a few seconds of inhaling, it travels to your brain, causing you to have a temporary high. Over time, your brain changes, causing you to smoke more to get the same effect. We rate your addiction to nicotine with a few simple questions. Do you smoke more than 15 cigarettes a day, or smoke within 30 minutes of getting up in the morning? Do you find it difficult to go more than 4 hours without a smoke? The power of nicotine comes from the repeated small doses you give yourself when you smoke. It may seem innocent at first, but if you take 15 puffs from a cigarette and smoke, say, 20 cigarettes a day, that's 300 drug doses a day. You think smoking relieves your stress or is satisfying, but it actually isn't. The cigarette is just making your nicotine addiction go away. Smoking doesn't make your concentration better. It just calms your nicotine receptors' cry for more. Smoking makes your heart beat faster, increases blood pressure and breathing. These are all symptoms of stress, not stress reduction. Let me repeat that. The cigarette just reduces your nicotine stress, not your real stress. I've got a lot of trigger times: coffee, sex, meals, certain people, break times, telephone calls, the car. There are a lot of triggers you're going to have to prepare for. You got to change your coffee routine, plan something to do right after meals, throw out your car ashtray. I have no advice on sex, but make a plan for breaks or the telephone with lots of distractions. Know that when you have a hunger or caffeine or other types of pangs, you also have a nicotine pang that needs to be satisfied. You have associated these, but they're actually separate. Alcohol and parties double the risk as you have the association, plus you're imbibing something that tends to lower your resolve. I want something in my hand. Yes, you are making maybe 300 hand motions a day. You may need to replace this by chewing gum or chewing on a straw or a cinnamon stick or playing on your cell phone to keep your hands busy to replace this daily habit. I will gain weight. Yes, you might, but I think this is actually more marketing than reality, what I call the Virginia Slims effect. On average, people who quit gain about 2.5 kilograms or 5 pounds. So, two thoughts on this. Firstly, if this is a concern for you, you might want to focus on strategies that affect calories in and calories out, such as your new daily routines might focus on walking, a special emphasis on being mindful of emotional eating, or that your hand mouth routine includes carrots or celery sticks. My second point is about perspective. A possible 5 pounds may be important from a vanity perspective, but from my doctor perspective, the health return is spectacularly higher when you stop smoking. Remember, we said smoking was a relationship. Part of the healing of stopping a damaging relationship is starting new healthy relationships. So now is the time to start a deeper relationship with your bicycle or salads or walking or gardening or your supportive friends. Next is the how. What are the skills required to change? How do I change with the emphasis on I? So what works? Well, let's start with willpower. It's a strange word. On the one hand, it permeates behavior change and all the interventions we talk about. It's also a word I don't love as people see it as black and white. If a person succeeds, they have willpower, and if they fail, they have no willpower. The science of willpower in smoking gives a mixed message. Approximately 5% of smokers who try to quit cold turkey achieve prolonged abstinence for 6 to 12 months, with most relapsing in the first 8 days of attempting to quit. On the other hand, most people who quit do so unassisted. Maybe two-thirds to three-quarters of people do so by themselves. Reconciling these two stats reveal the natural history of smoking cessation, that, quote, failures are part of this process and can be seen as dress rehearsals for the eventual success. Another key pearl here is the data which tells us that our perception of the quitting smoking experience is often much darker than reality. In a British study of people who were surveyed about their quit experience, 53% said that it was not at all difficult to stop. 27% said it was fairly difficult, and the remainder found it very difficult. So to summarize, you can do it by yourself, and it may be less difficult than you think. On the other hand, it looks like your chances are better if you layer on some other tactics. So if you fail, try again and think about adding another strategy. Some say there are two types of cigarettes, those that are dealing with your nicotine addiction and those that have become part of a routine. So let's see what works for both these types of cigarettes. Let's start with treatments that have not been proven effective and where you may be wasting your money. Now, some of my patients have found they help, and to be honest, if they stop your smoking, I suppose I don't really care. But under this category, I put laser therapy, acupuncture, and hypnosis. When we compare these treatments to a placebo or just compare them to the quit rates of people on waiting lists, the rates don't appear to be improved. Next is medications to help stop smoking. The data shows that medications, especially when combined with behavioral support, can double your chance of success. Many patients are resistant, which I get, but I also see an irony in the fact that people are willing to inhale chemicals much, much worse for them, but they won't take a medication for a few weeks or months to stop smoking for the rest of their life. If we use nicotine replacement therapy as an example, it allows people to deal with the addiction of nicotine without having to inhale the other 7,537 chemicals in cigarettes. And that's what I worry about. People die. 2 full 747s of people a week in Canada from smoking, not nicotine. Nicotine replacement therapy comes in multiple forms, and there is usually less nicotine than what you get in a cigarette. You can put on a patch, which is easy and discreet. You can chew gum, although in a different way than you usually chew gum. You can suck on a lozenge, or you can use an inhaler. The patch gives you a nice baseline nicotine level to lower your cravings. The latter three offer the advantage of flexible dosing when you have a nicotine craving and a familiar routine of opening packages and putting something in your mouth. Important things people need to know about nicotine replacement therapy are firstly, you can design your own nicotine program. You do not need a prescription. Prefer the patch and then the gum or lozenge or inhaler for breakthrough cravings? Great. Maybe you smoke under 10 cigarettes a day and just want to use the gum when you need it. Your pharmacist can really help here. People get a bit confused with the cost. NRT is generally cheaper than smoking, but you might be buying a month at once. Money wise, of course, it's a no brainer. A pack a day is maybe $3,600 a year. Imagine what you would do with that money. Imagine what you would do with 10 years of that savings. Secondly, with nicotine replacement, you can stop cold turkey or you can wean down your smoking. Taking nicotine and smoking together does not increase your risk of heart attacks. Smoking does. You probably started smoking gradually, and I guess the same can be true of stopping. If you feel you need another month of NRT, then that's fine. I'm not going to go into details of pills for smoking cessation, but I will give you a quick overview of the two most known ones. The first is Zyban or bupropion. It started just as an antidepressant, and then users found their desire for smoking dropped and they were able to quit more easily. Champix or Chantix in the US is varenicline, and it is a newer option that may be even more effective, but also has some side effects that may make it not for everyone. You can discuss these options with your doctor or other healthcare provider as the counseling needs to be individualized. The final approach is the behavioral interventions. I covered some of this ground, but I don't think people realize how many fantastic resources are out there for them. Governments make a lot of money from people who smoke, and they funnel into superb programs. You want a text message, a supportive email, you want expert counseling, want to be connected with other people going through the same thing, or who have just been there. Or maybe you just want to talk to someone. Go online, call the helpline, buy the book, get the message. In the first months following quitting, I want you to prepare for the roadblocks of risk and stress. So avoid high risk situations. You know what they are. You might want to tell the people involved in advance. And I want you to focus on stress reduction. Stressful things are going to happen to you, but you create the stress. Tell people, hey, I'm quitting smoking this month, so what's the least stressful strategy that works? I also get people to think about the three A's. Avoid situations you know are stressful for you. Alter expectations. So when you look at your to-do list, be realistic. Manage expectations up front before it's stressful. And the final A is acceptance. If we use driving as an example, traffic jams, bad drivers, and flat tires happen. Take a deep breath, focus on what you can control, and accept what you can't. Now, let's say you quit smoking. That's excellent. You've broken up. So what now? Well, first of all, you're great. Secondly, there's going to be some ups and downs, more ups, especially after you get through the first months. But some of the things to expect with nicotine withdrawal are cravings, and these don't follow a perfect line. Headaches, nervousness, irritability, trouble sleeping, and you may want to eat more, so have some healthy foods ready. And also, people tend to have more of a cough as their lungs self clean. Finally, the Japanese have a proverb that success is falling down 7 times and getting up 8 times. If you get derailed, don't feel guilty. As I said at the beginning, this is a journey. Come back and see us. This is the best thing I can do for you. Don't learn helplessness. Learn about yourself and get ready for the next round. And thanks for listening.
All right. Well, thanks for staying with us for that video. And now I want you to actually get a piece of paper and maybe a pencil handy, and we're going to have a couple of exercises where you're going to maybe turn the video off momentarily, just to really jot down a couple of things, because we want you to be on track as far as thinking about the reasons why you want to quit, and maybe why now versus, let's say 6 months ago. So at this point, I want you to really write down, why do you want to quit? Why now? And try to think of this. If these things that you write down were not happening, would you still be looking to quit today? And that sometimes helps you identify the real reasons why you want to quit. So go ahead and turn that off right now, and then you can come back to it after you've jotted down the reasons why you're wanting to quit at this moment. Okay, you've jotted those down. Great. Now I want you to consider another thing that I want you to maybe, put a couple of notes down for. What do you like about smoking? And people laugh when I ask them this, but it's important to realize that you you have a love-hate relationship, and that's what we call the ambivalence of smoking. You love it and you hate it at the same time. So I really want you to really be serious with yourself and, and be honest. What do you like about smoking? And turn the video off now for a moment and jot those things down and really think about that. And you guessed it, we're also going to be doing this exercise is what do you not like or what do you hate about smoking? And that's an important feature as well. So go ahead and turn that video off now and just take a moment or two to really write down what do you hate about smoking at the present time. All right. Well, welcome back. So we're going to keep those in mind as we kind of go along, and those are going to be helpful as as maybe you do a quit attempt, and and things kind of get tough. It's always good to kind of look back at those things and really remind yourself of the reason. So again, this slide covers some of the benefits of quitting smoking, and some of that was covered in the video as well. But it's important to review. We do know that the nicotine itself is actually causing a lot of issues with raised blood pressure, and the ingredients within the cigarette are actually decreasing the amount of oxygen you have available. So by quitting, you will be able to lower blood pressure very, very quickly. You're also going to be decreasing the chance of having breathing problems, and also you're going to be, decreasing the effect of having constant forms of nicotine in the brain. So those habits eventually, or those urges, will kind of go along. People are always asking about how quickly their lungs will recover, and we do see differences in the lung function and improvements in the lung function relatively quickly, but we're looking at months and years for some of those effects to occur. So the benefits of smoking are many. And as smokers, I think you realize that they're there, but they're often outweighed by the fact that you may enjoy smoking and that it's a big part of your day, and that's become routine. So let's talk a little bit more about that. Before we do that, the obviously the detriment of smoking, it is involved in increasing almost all cancers that individuals get. As smokers, I'm sure you're aware of this fact, and it's not lost on individuals, but it often doesn't outweigh the fact that they're still smoking, and we understand that. So there's really two addictions. I tell people, congratulations, you're an expert smoker. And what I mean by that is you do two things. You actually feed a physical addiction, but you also feed a hand mouth addiction. If you do this with your cigarette at a pack a day, you're doing it thousands of times a year. And if I did anything, for 20 cigarettes a day, for example, if you're a pack a day smoker, if I did anything 20 times a day for 20 years, I'd be really darn good at it as well. So there's two things we need to address. It's often the physical addiction, and there's also going to be the habit or the things that you have linked very closely to smoking cessation. I tell people that you've linked things like your meals and your coffee or having alcohol with a cigarette, like ice cream and apple pie. And we really want to make sure that we're looking at that fact when we try to think about quitting. So there's two things. The medications we may suggest later on will help with the physical dependence, and we have great ways to control that. And then your job as a person looking to quit smoking is to really develop the non smoking behavior. In essence, you're adding a part time job to your life to become an expert non smoker. You're an expert smoker now because you do it so often, you link it to everything. Your job becomes to become an expert non smoker. Interestingly, we're going to use the same system that made you an expert smoker to make you an expert non smoker. You're going to start with small changes in behavior to go to non smoking activities, and eventually you'll do that all the time when you think about a cigarette, and that will then become your new behavior. So, quitting strategies. A funny little joke here for you. My doctor told me to stop smoking cold turkey. That was easy because I never smoked cold turkey in the first place. As mentioned, cold turkey is a way that some individuals do try. As you saw from the video, the success rates are probably about 5% at about a year. So very, very low. And most people who do a cold turkey attempt will relapse in the first 8 days. And that's really where we want to really make that strong suggestion to consider medications. A lot of people I hear or I talk to say, oh, I don't like taking medications or drugs. Well, guess what? You're doing Smoking is bringing in over 2,000 chemicals into your body, and in many cases, 20 times a day. All I'm asking is to think about maybe taking a medication for maybe 12 weeks, 2 or 3 or 4 months to help you quit for a lifetime. So that's really where that, again, that suggestion for using the benefits of medication may come in handy for you versus trying to do it without. Interestingly, people always ask about some of these other modalities. And again, I do know individuals who have been successful for short periods of time. I don't know many that have been successful long term, but for short periods of time, it works. And if it works, great. I'm not going to argue with that at all. But we really don't have any evidence that it is any more successful than a cold turkey situation for things like laser, hypnosis, acupuncture, and aversion therapy. So many people ask about that, but the evidence is not there to support its success in long-term quitting. So nicotine replacement, let's look at the different forms of nicotine. First of all, nicotine is not bad for you. A lot of people feel that it's the nicotine that's bad. No, if your healthcare provider and I could get you on clean nicotine for the rest of your life, we'd be pretty happy because it's not having that detrimental effect. Sure, it's the addictive ingredient in the cigarette. We know that. It will raise blood pressure a few points, and it's a bit of a stimulant as well. So you might have trouble sleeping, those kinds of things. So knowing that the nicotine is not the bad part, what we do is we kind of help to feed our addiction to avoid the physical withdrawal part by giving you a clean form of nicotine and then slowly starting to wean that. For the most part, the actual baseline nicotine treatment is going to be a patch. Hopefully, you can wear it. Some people do have problems with the glue or the adhesive on the arm, and we have ways to kind of avoid that by maybe rotating sites. So maybe one day you'll put it on the outside of this arm, next day you'll do maybe on the upper chest if you don't have any hair there, which obviously to help it stick, and then maybe you'll rotate over to the other arm. So a different place every day to avoid that glue or the adhesive in causing problems with kind of a rash or irritation. So the baseline is going to be a nicotine replacement. We're giving you enough nicotine to keep you physically comfortable relative to what you're smoking now. And it's important that if you're smoking more than a pack a day, to maybe talk to your pharmacist or your physician about how much nicotine you might actually need to control that physical part. But for the most people, if you're smoking somewhere between, let's say, 10 and 25 cigarettes, the actual normal regimen will work for most people. And it works to be about 10 to 12 weeks of nicotine replacement. We start you at a step one. We do that usually for about 6 weeks, and then we drop you down for a couple of weeks on step two, couple of weeks on step three. I use the analogy of a little devil on your shoulder. So think of your physical addiction as something on your shoulder, and that devil yaps at you 20, 30 times a day, and you feed him just to kind of keep him quiet. So really what we're doing is we're now giving this devil on your shoulder continuous nicotine. He's at a buffet. He gets to eat as much as he wants. He's happy. He doesn't yell at you. So really, we're just keeping you physically comfortable so you can do the important part of learning that new behavior. Sometimes for short acting nicotine, we'll use a gum or a lozenge or a spray or an inhaler, and you can see those on the screen itself. Very important note here at this point. The actual lozenges and the gum are not used like a regular candy or a gum. You don't chew it or suck on it continuously. You will suck on it and chew on it for about five to 10 seconds, and then park that in between your cheek and your gum. Very important to realize that if you have plates or false teeth, that stops the access to the gum tissue, and that will limit the effectiveness of those products. The spray, many people come in and say, I tried, it was way too strong. We have a suggestion just to spray it onto your finger and then rub your gums with that finger to get that nicotine liquid in contact with the gum tissue. Some people will use the spray, and maybe just the act of that very strong sensation is enough to kind of distract them from the smoking. If it is, great. The inhaler of note, it is not inhaled. And that's unfortunately something that a lot of people do feel that based on the name, it's not inhaled. The actual inhaler is really just a nicotine delivery device that kind of looks like a bit of a cigarette. And then it has a gel cartridge. You can see them there in this silver foil. And that gel cartridge goes into that white device, and then you actually puncture it. And from there, it actually gives you the gel that you can then draw in. So I use the word sucking instead of inhaling because it's a very strong sucking motion, like on a very, very small straw with a thick liquid. It's that motion to get a bit of gel into your mouth. And again, it's absorbed through the gum tissue. I will often send people to YouTube just to kind of look at how these products are used properly as well, if you're looking for a video. So, other than that, we have actually medications to help quit smoking that are often oral or a combination product. So, you'll see them on the screen. We have Champix. If you're looking at American channels, it's called Chantix. Same thing. We also have Zyban, as the video mentioned. This was originally brought on the market as an antidepressant, and we found that it actually helped individuals who were using it to help smoking. So we actually, or sorry, to help quit smoking. So we know it does work on those habit chemicals. We have a product that was developed out of Kitchener, Ontario called Crave, and it's a formulation of cytosine, which has been used in Europe for a long time. Very similar mechanism to the varenicline or the Champix as well. So it kind of blocks the effect of nicotine in the body. And for some people, we'll use a combination of things like the Zyban for the behavior change or those habit chemicals, maybe using it in combination with a nicotine replacement. Just of note, we don't usually use a combination of nicotine replacement with the Crave or the Champix because the mechanism of action for those two products is blocking the effect of nicotine. So giving nicotine in a patch form doesn't make any sense with those products. So often the combination is going to be NRT, which is the patch, the gum, with something like a Zyban. And again, talking to your healthcare provider to select the one is really what you need. And I'm going to give you some resources on who you can talk to at the end. We suggest 3 months for all medications. People ask me why, and I say, well, it has nothing to do with the drug. We just know from behavior change theory and experience that learning a new behavior takes somewhere between 2 to 4 months, and we happen to pick 3 months in the middle. So that's it. We do know that success is dramatically different if you only take it for a month versus 2 months versus 3 months. And then it seems to kind of even off at that point. So 3 months is really our magic number. So consider that being your plan as well. So let's talk about Champix in a little bit more detail. As I mentioned, it blocks the effects of the nicotine, but what it does is it works on the same receptor in the brain. And why that's important is this: by blocking the effect of nicotine, it also sits on that receptor and keeps you out of physical withdrawal. So you don't feel the effects of physical withdrawal. It blocks the effects of that nicotine. There's no drug interactions with this product, which is quite popular with most people, especially if they're worried about other medications interacting. And it's actually covered by most private plans, and it's also covered by the government plan as well in Ontario. We do suggest as well with the Champix that taking it for those 12 weeks is extremely important. Some side effects may occur with this product, and we do know that it may, for most people, they may get a little bit of a mild stomach upset or a GI distress. Sometimes it comes up like a nausea. Often we'll suggest individuals to take it after a meal. So it's often taken twice a day. So maybe after breakfast or after supper. If you don't eat breakfast, maybe even just considering a bit of a granola bar or maybe a piece of bread. We do know as well with this medication, as well as some of the other products, you will dream a bit more vividly. Hopefully, those are good dreams, but if they're bad dreams, again, you have to decide, is this something that I can handle? Usually, I tell people whatever happens in the first week is pretty well what you're going to see for the next 12. And again, most people do perfectly fine, but there are some individuals who are a bit more sensitive and they just find the dreams bothersome, and that may limit their ability to take the medication. Zyban. So again, it reduces the cravings related to smoking. So I think I like to explain it of is it works on the habit chemical itself. So you can actually combine it with nicotine replacement for a slightly higher success, and that makes sense because the nicotine replacement is really covering the physical part of smoking, while the Zyban is maybe looking at the behavior part. It's important to realize that this medication should Probably not be used in individuals who have a history of having seizures or individuals who may have some eating disorders. Because of the chemicals that it works on, it can actually, be a problem with these two types of conditions. Some drug interactions do exist, so we do ask that you contact your physician or your pharmacist to discuss whether Zyban might be something that might work for you. Crave, and again, it's cysteine. And again, it's a non prescription medication in Ontario. It's similar to Champex from its mechanism standpoint, and it's about a 5 week course of medication. You're welcome to take it a bit longer as well if you want that effect a bit longer to help work on that behavior. But it does come in, and most pharmacies in Ontario can have access to it. I find that some will carry it, some won't. So again, just call your pharmacy and ask for Crave. So CRAVV comes packaged in a black bottle, and it's around $60 for a 5 week course. So nicotine replacement therapy provides that 24-hour withdrawal coverage. That's really important that people realize it's working for 24 hours in that patch form. It's constantly giving nicotine. Dosing is important. If you're a really heavy smoker, you may need more than what's recommended on the package that you can get off the shelf. So it's important that you talk to your provider. If you're finding that you're a very heavy smoker, we may make an adjustment in the amount that you use. And often that means combining patches to give you just slightly more nicotine because your body's used to quite a bit of nicotine based on how much you smoke. As mentioned, you can supplement those with those short acting forms, which are really two things. They give you a bit of shot of nicotine, which is what you're looking for. But more importantly, I think it also gives you the ability of having a distraction, taking something out of a package. It kind of mimics opening up a pack of cigarettes as well. And again, reminder, they're not used the same way. Do not chew it like a regular gum. Do not suck on it like a candy. It's just going to give you a sore throat and an upset stomach. They're intended to do it for a short period of time and then put in between the cheek and the gum and then pull them down every couple of minutes. It's that behavior back and forth that really kind of helps with distraction. And we talked about that rash on that patch and how to avoid that. So, drug smoking interactions. This is an important factor. When people smoke, it actually metabolizes the amount of caffeine your body gets from all your caffeine sources. So that's why I will often ask people, how much caffeine do you take in? If you're only doing a couple of caffeine sources, maybe one or two coffees a day, maybe a pop or something, you probably won't get into situations. But if you're the individual who does, let's say, more than 4 or 5 caffeine beverages, and that's combining tea, coffee, and pop, then you will find that as soon as the nicotine level goes down, the caffeine will hit you much more readily. So I tell them that the caffeine is going to hit you like a Mack truck, and that's important because caffeine intoxication. That's a funny word, but that just means getting lots of caffeine more than you're used to. That can mimic those symptoms of withdrawal. I'm getting agitated. I get a headache, upset stomach. That's really withdrawal from caffeine. It has nothing to do with the nicotine withdrawal, just to let you know. So, okay. And that happens when we have a dropped level of nicotine because you're trying to quit. There is also lots of other interactions, specifically with the medications listed there. But again, talk to your pharmacist if you're on other medications and they can kind of let you know as well. And that doesn't mean you can't take them, but we just have to be more cautious on certain things. So, e-cigarettes or vaping, those are actually two different ways of explaining the same process. So this is really going to be a juice. It's often a combination of nicotine or a propylene glycol, and that's really what we call a vehicle. And often these products will have other things in them as well. We actually don't know the effects of getting some of these other ingredients in the actual juice itself, like the propylene glycol. We do know there's ones that are a bit of a problem. I'm going to mention those just a little while. And the ones that were the problem are really the the actual juice or the nicotine vaping products that contain cinnamon, cherry, menthol, and products that contain diacetyl. I live in an area of Ontario where we have access through some of the native reservations to some of these products. Again, some of them may be regulated or not. We do actually ask that if you're going to be using these products, to use the well-known products. Make sure they don't have any diacetyl in them. And again, the actual caution is, because we don't know the long-term effects of using some of those vehicles like the propylene glycol, we're just not thinking they're great, but we do know individuals are going to use them. They actually do have relatively new, have demonstrated success in using a vape to quit cigarettes. So often people will be using them in combination. But if you're thinking of, I'm going to go from a cigarette because somebody told me it's bad, I'm then going to go to a vape, and then I'm going to slowly decrease the amount of nicotine that I have in the juice itself. That's really the technique that is shown actually to have some benefit for individuals. My only caution is from a behavior standpoint, the vapes are used everywhere. You can use them in most places like public buildings, etc. And that being said, it may actually introduce more situations where you link that behavior with an activity. So that's my only caution that I will give people as well. We think it might be lower risk than tobacco because it doesn't have all those other chemicals. But again, with the nicotine, there is that vehicle as well with that propylene glycol in most situations. So it's kind of a catch 22, unfortunately, but we know that a lot of people do it. And if you're thinking to maybe use that as a way to quit smoking, I'm just glad you're willing to try to quit smoking. So your pharmacist and your doctor can help you in that regard. So again, some recommendations if you're going to use vaping and maybe coming off the vape as well. So if you're doing both the vaping and the smoking, it's recommended to switch all your nicotine to a vaping form. And that's really just because we only want to deal with one animal at a time. So again, we think it might be a slightly safer because it doesn't have all those other chemicals that we don't like in the cigarette. But again, it's going to make it a little bit easier from a behavior standpoint if we're just stopping one behavior instead of two. So again, if you're doing both vaping and smoking, move it all over to the vaping. And then again, use that e-cigarette or that vaping cartridge with less nicotine. They come in different strengths, use lower concentration. So like a patch, we start on the high strength and slowly wean down. We would do the exact same thing with the vape juice. Start on whatever you're at with your nicotine juice and then slowly bring it down to a non-nicotine eventually. And again, only use vaping devices that have been authorized for sale in Canada. Be careful of the products that you get in other places that aren't regulated. We do not know what they have in them, and that's where that might introduce some of those dangerous ones that we mentioned earlier. Maybe use similar pharmacotherapy. So it's interesting if people have trouble coming off of a vape juice, we will often use the same thing. We'll use a Champax, a Zyban, the nicotine replacement. And again, really, we're just trying to keep you comfortable because that vape is introducing that physical addiction to nicotine. We're doing the same thing. We're just trying to help you be comfortable physically by using these other prescription products to help. One-on-one counseling with behavior will increase your success rate. That's the same whether you're doing cigarettes or vaping. Talk to somebody, work on the behavior change. Cannabis. So we often hear about the situation. My concern as a person trying to help individuals quit is that cannabis is a trigger for tobacco use. Often people will use them together. They'll often roll them together in the same cigarettes. They'll have a cigarette after they have cannabis to kind of intensify the effect. So it's the trigger for tobacco use. Often, if individuals are looking to quit smoking, I will assist them even if they're looking to continue smoking of the cannabis. But my experience, and often the experience of many individuals, is that you will find that by decreasing the cannabis use, you have less triggers for the tobacco, and that is much better. And again, if you're going to use cannabis, we do suggest that you use non-combustible forms. And that's going to be a dry herb vaporizer, some edibles or oils, versus the smoked form, which is often going to have some of those other things in there that cause the damage in the lungs. So psychology of quitting, and this is going to be where we're going to be looking at a few different things. We're going to be looking at what are your triggers, specifically what are yours, and how do you maybe plan to manage the withdrawal, and what kind of things can you distract with. So let's talk about those in a little bit detail. So triggers. You may want to stop this video and just maybe write down all the triggers that you have. This is actually, a suggestion of what most people, from what we hear in our interactions, consider triggers. So the morning coffee, after the meals. If I ever ask anybody if you only had 4 cigarettes that you were allowed to smoke every day, when would you smoke them? These are the times we see social situations, the break at work, when I'm talking on the phone, going to a party. The vehicle is a very strong one for lots of people, so that's a trigger. Getting in your car. As soon as I'm in my car and I get that seatbelt on, that cigarette comes out. Things like lighters, ashtrays, when I see them, when I feel them in my pocket, those are the things that trigger me. And again, visual. It's not coincidence that there's lots of smoking in movies. They want to increase the amount of people who smoke, and that what they're doing is that they're triggering individuals to think about smoking. So managing withdrawal, we actually use the 4 Ds. And again, no, it's delay, drink water, deep breathing, and distraction. And really, we're delaying the cigarette. So again, say, you know what, I'm not going to have it now. I'm going to delay it by a half hour and then maybe delay longer each and every day. Having something to drink. The water is important because you can drink it all day. And that gives you that same hand mouth addiction as smoking would, to have a water, whether it's a bottle or a glass, doesn't matter. Deep breathing is really just focusing on something else other than the actual urge. Remember that little guy's yapping at you on your shoulder. You can do some deep breathing so you don't have to think about him, because you're thinking about the process of breathing itself with again, with the actual diaphragmatic breathing and those kinds of techniques. Last but not least, we have distraction. It could be anything. Anything that takes your mind off smoking definitely will help. So distraction, little funny video here. The husband actually gave up smoking, so he ended up using another hand mouth technique called sucking your thumb. Not so much as an adult, but it gives you the idea that you just have to consider things that you may not consider normally to help distract you. Some of the things actually might be, again, when I talk to individuals, I ask individuals to write down a whole list of them every day. And if you're a pack a day smoker, that means you're going to have about 20 non smoking 5-minute activities written down on a piece of paper. And these are some of the things you can use: candy, regular candy, lozenges, bubble gum, maybe do things like 10 jumping jacks, any kind of exercise activity. Maybe go onto your elliptical that's holding your laundry and collecting dust in the basement. Jump on there for 5 minutes. That is perfectly fine. You don't need to break a sweat, but it's a good distraction because you have to think about what you're doing or you're going to fall off. So some people will do things that gives them a strong taste sensation, like eating a dill pickle, for example, or drinking a flavored water. Whistling is going to be a good one. Whistle your favorite song. Some people actually go and brush their teeth, because guess what? It doesn't hurt, and people don't have a sensation of having a cigarette after they brush their teeth. It is a negative sensation, so they'd rather just brush the teeth, and then their brain tells them, well, guess what? You've never had a cigarette after brushing your teeth because it tastes horrible. You're not going to have one now, and that's that distraction's purpose. Get you past that 10 minutes of the urge, 5 or 10 minutes, whatever it is, and then that urge will go away. Sure, it'll come back in a little while, but guess what? They eventually will get less and less and farther apart, and then you'll becoming easier to be a non-smoker. I will actually put this up for all individuals over the age of 40. If you've been a pack a day smoker, or if you have a 20-year history of smoking, this is actually a short test called the Canadian Lung Health Test. If you mark yes to any of these, you may be at risk of having COPD. And COPD, we used to call it chronic bronchitis or emphysema. And for those individuals who may be at risk for that, it's important to contact your doctor. And there's a further breathing test that's called spirometry. Relatively easy to access, but it's important to realize that if you have COPD, there are medications that we can use to help make you more comfortable and help you with your breathing. But then we also will do a really full court press on the smoking, because in North America, 99% of COPD is caused by smoking, and there's only one thing that speeds it up, and that's going to be smoking as well. So we'd rather not see those end stages of COPD. If you've seen anybody with emphysema after a while or those kinds of things, that's, that means oxygen. So we're trying to avoid those. So have a look at these questions, stop the video, answer the questions. If you answer yes to them, you're over 40 years of age, you're a current or an ex-smoker, by all means, contact your doctor and say, you know what, I did the Canadian Lung Health Test. I screened positive. Any chance we can get a breathing test done? And it's called spirometry. Yeah, great. Lung cancer screening, again, another plug for a screening benefit here. If you have a history of heavy smoker, and what that means is a 30 pack years. So the number of years smoked on the average pack. So if you smoked 30 years of a pack a day, that's 30 pack years. If you smoke, let's say, 2 packs a day, that's only 15 years at 2 packs a day. So again, if you're a current smoker or quit within the last 15 years and you're age 55 to 80 and you were a heavy smoker, it's important to tell your doctor, you know what, we haven't talked about this much, but any chance I can do an actual lung cancer screening? And they really just want to make sure that if anything's developing, that they'll catch it early. So this is going to be some homework for you to become an expert non-smoker. Identify your triggers. If you're wondering how to do that, I'll tell you this right now. The best thing you can do is actually do a smoking diary. And this is a really good one. The smoking diary is easy. You write down all the cigarettes you have. So pick a couple of days during the week, maybe a couple of weekend days, and just track the cigarettes. We're not telling you to change anything. Just smoke when you would normally do, but mark them down. And the information you want to record is this. So if you have a piece of paper, what number of cigarette? Was it my first one, my second one, my third one? Where was I? What was I doing? Who was I with? That's a really important one. I would also say, how are you feeling? Is this a stress cigarette? Is this because I'm really happy? Is this because I'm sad, emotional? So it's important to identify that. I also have individuals mark down how badly they needed the cigarette. A number one, for example, on a scale from 1 to 5 would be, you know what, I probably could have done without. And a number 5 is going to be, I'm going to tear somebody's face off if I don't get some nicotine. So really what we're trying to identify, what are some of those parts in the day where you have a lot of ones, twos, or threes? Those are the ones that if you're looking to make any changes in behavior, or those are the ones that if you're thinking of tapering, those will be a lot easier for you to taper off. So identify those. You can learn a lot about, oh man, I'm having a cigarette every day after supper. I'm having a cigarette whenever I'm on the phone talking to my friend Jane. Guess what? If that's it, those are your triggers, and you really have to have a plan when you're thinking about behavior. What am I going to do when I'm on the phone? Well, guess what? I have to stay inside the house. I have to have something in my hand. Maybe I have a toothpick as well in my mouth while I'm speaking. Those are the kind of things that you might be able to find out. So identify your triggers. Make a list of distractions. I really tell people this. You need a physical list in your pocket. If you're thinking, this little devil on your shoulder, he's really good at yapping at you, he knows all the buttons to press, you will not think clearly in the middle of an urge. You won't, 100%. That's why having the list is important. Have the list, pull it out of your pocket. Oh, yes, that 5 minute activity, go and do it. Get past that urge. Don't worry about the other urges in the day. Don't think that far ahead. Get rid of that urge, move on. Practice mindfulness when smoking. This is where that deep breathing is a good exercise. Think about other things, maybe planning a trip in your mind, maybe some other mindfulness exercises. So if you're looking for some of that, pop onto YouTube. They have lots. I'm going to ask you to set a quit date. Guess what? Like the video said, if it's going to be hard now and it's going to be hard in 5 years, why not do it now? I hear this all the time. Well, it's not a good time. I have a lot of stuff going on. Well, guess what? You've had a lot of stuff going on in the last year. You're also going to have a lot of stuff going on for the next 5 years. There's no perfect time. Set a quit date and try something. The worst that's going to happen is, guess what? Maybe you don't be successful this time. We do know that individuals, for serious attempts, it sometimes takes between 3 and 4 serious attempts for one to take for a year or longer. So guess what? Let's get some more attempts. And if you think about it this way, any attempt is a good way to learn something about yourself. So if you've identified that some sort of barrier that brought you back to smoking, well, guess what? Next time you try to quit, you need to definitely address that barrier. So if you think of every quit attempt, if I can learn one thing from it, it's not a failure. Please understand that. Book some one-on-one counseling. And again, your community pharmacist, your physician, most physicians' offices or addiction centers will actually offer counseling as well. And advice from a clinician will increase your chances of quitting by about 30%. We'll often say it doubles your chance as well. Yeah. So let's talk about counseling options. There's a lot listed right here at this point. I think the one I'm probably going to send most people to is going to be smokershelpline.ca. You see that blue box with that internet address underneath? This is a great resource online. And why it's so good is because they're going to then link you to a lot of other things out there as well. You'll see some of the programs that are listed there, but the Smokers Helpline, I think, is probably the most accessible, probably the most used, and they have access to a lot of different things. They can actually set up for text programs, help educate you a little bit on some of the things that are available online, those kinds of things. So, counseling options, look at maybe your addiction services, look at your health unit. If you're part of a family health team, often they'll have counseling available as part of your family health team staff. And again, because we're with the Thames Valley Family Health Team, each of our sites has someone who can help you with the counseling as well. If not, and you're not part of a family health team, by all means, talk to your family doctor or nurse practitioner. They can send you in the right direction. Smokers Helpline have counselors right on the end of the phone. So there's a phone number there or the internet address, smokershelpline.ca. Okay. For anybody within a marginalized population, the queer and trans communities, we have specialized counseling projects, supports for individuals in this category. It's called the Expand Project, and it's www.expandproject.ca. So feel free to access those resources if needed. Phone apps, really big push for this one. I find people love them. They it really helps them engage in the process, and it gives them some positive reinforcement as well. So break it off as from the Cancer Society, the My Change Plan, and I Can Quit. So again, look at these. Most times these are free resources. So jump on one and just get engaged. It's really good to kind of see the tracking, to and then the actual fact that people mention all the time. I like it because it tells me I'm doing well. It's that motivation, it's that support by doing the positive reinforcement. So please grab a phone app. You have a phone, use it to your benefit. Great. So accessing free nicotine replacement. Many programs actually have the access to free nicotine replacement. It's called the STOP program, and it allows individuals on the program to get up to 26 weeks of free nicotine replacement. If you're part of a family health team in our particular area, if you're part of the addiction services or part of SOHAC, those programs are the same and they will give you STOP. So again, if you're not sure if you're part of these groups, check with your family doctor, usually just calling the office, how you would make an appointment and ask them, do you have access to any free nicotine replacement? Am I able to access that through you? So this is for individuals who are part of these organizations. The next slide is going to be individuals, and these are our sites within the family health team. So if you accessed it through our website, maybe through a healthcare provider, guess what? You're part of our organization. But if you're part of the public and you're not sure if your doctor is listed at any of these clinics, very likely you are part of our organization. And again, call them and ask for support. If you're not, then the next slide is going to be for you. So free nicotine replacement for individuals not part of these groups is available on Stop on the Net. So www.stoponthenet.ca, and it gives you it's a self-referral, gives you up to 10 weeks of nicotine product that is actually sent to you directly. There is also the Ottawa model for smoking cessation, and I have a slide coming up on that one. That's a self-referral as well. Even though it's from Ottawa, it is accessible to all individuals in Ontario. And sometimes the health units as well. So for Elgin and Oxford, the health units do have access to free nicotine replacement as well. If you are First Nations or Inuit in the province of Ontario, the NIHB program will give you free nicotine replacement, and some private drug plans actually still cover it as well. So first choice, I would say, Stop on the Net, register yourself. They send you the nicotine replacement through the mail. And if not, then just check with your pharmacy to see if your plan covers nicotine replacement. And if not, guess what? You can always buy it off the shelf. And again, the cost is not that restrictive compared to the cost of cigarettes. This is the Ottawa model for smoking cessation. You'll see the 1-800 number. And again, you would leave your contact information on the voicemail and they'll contact you. They'll get back to you to say, okay, how can we support you in helping quit or wanting to quit? And they're very, very helpful. So, yeah, just a different program. There's lots of them out there. This is just the plug for the public health units. So again, for Oxford and Elgin, public health units are working actually through some of the local pharmacies to supply that. You'll see the registration numbers on the bottom left-hand corner of the screen. Prescription medications, how can you get them? Well, guess what? Most people know they can get them from their family doctor or their nurse practitioner. The best kept secret in Ontario is you can also get it from your pharmacist. You can get it through the family health team pharmacist. More likely, everybody has a community pharmacist that they see for their prescriptions. These individuals have been able to prescribe the Champex and the Zyban for about the last 15 years. So please go see them and say, you know what, I'm ready to quit smoking. I heard that you can help me with some medications, and find a pharmacy that's willing to help you in that regard. Guess what? That's the end of our session. Thank you very much for joining today. I really appreciated your time. I would encourage you, try to quit. Try different things. You have to think outside the box. The biggest advice I give people is, you know what? Change your relationship with cigarettes. You have a very intimate relationship with cigarettes right now. And that intimacy means that you're going to be afraid of saying bye to that cigarette. But again, I tell people the same thing. If you had somebody who put you down every day, would you keep that individual down, with you? And most people answer no. So that's important to realize that the relationship piece is big. And how you change that relationship is, you talk out loud to yourself. You say, hey, you know what, cigarette, we had some good times, but going forward, you're a bad apple. You're going to be the reason I'm not able to maybe see my grandkids, those kinds of things. So guess what? Get some help, get some medication. It really helps your chances of success. Find somebody to help you with the counseling. And thanks for taking the first step.